It's something that many people suffer with, yet 90% of cases go undiagnosed. Sleep apnea. I spoke with a local doctor about detecting the signs of this sleep disorder.
Sleep apnea. It affects over 40 million people, yet research shows that only 4 million receive proper diagnosis. Most people don't even know they have it. The most common type is obstructive sleep apnea. This condition blocks the airways as throat muscles relax during sleep. The result? Shallow and paused breathing. In other types of sleep apnea, breathing stops completely.
Early one morning, I woke up real abruptly and there was no air in my lungs. I mean, there was none. And it scared me, and I was trying to get breath in, and I was having a real hard time getting any air into my lungs.
Strawn has suffered from sleep apnea for 15 years. She has a friend who was diagnosed with the same condition, which prompted her to talk about the sleeping problems with her doctor. According to the National Heart, Lung, and Blood Institute, doctors usually don't detect sleep apnea during routine visits.
I was just tired all the time. I couldn't keep my eyes open in the morning, and I couldn't figure out why.
A sleep study determined that Strawn had sleep apnea. Symptoms include lack of energy, morning headaches, gasping, choking at night, and heavy snoring.
The most significant ways that a patient might investigate if they have sleep apnea or not would be they might have a bed partner that's telling them that they're snoring or gasping for breath. The bed partner might describe it as you quit breathing at night. In other words, the patient is recognizing, or the bed partner is recognizing the apneic event.
Dr. Bouzis says early diagnosis can prevent further health problems that come from sleep apnea.
What would happen is they're not going to develop the cardiovascular diseases that go along with it. Their likelihood of having a stroke is not as much because you've discovered the sleep apnea early enough on the curve that you don't have the organ damage.
Along with stroke and heart failure, obesity and diabetes are also associated with sleep apnea. If not properly diagnosed, life expectancy can shorten up to 18 years.
Dr. Bouzis adds patients should consult their doctor if they believe they have this condition.